I would like to welcome everyone in attendance to our discussion this evening. We will be discussing the COVID-19 vaccine and the cultural implications which impact vaccination. I am Laura Rodriguez-Carbone, and I'm joined by my colleagues Danielle Andrews, who is also in community outreach, and by Janine Pilgrim, who is the program director for the ESRD program. This evening, we will be talking about culture and how it relates to perceptions of vaccines, as well as ways we can work through some of the hesitation we may be feeling, thinking, or seeing. Just as a reminder, we've muted everyone. We will have some live polls, which Janine has graciously volunteered to help facilitate. If you do get disconnected from the call, we ask that you not place the call on hold. We just, are telling folks to just disconnect and rejoin when you're able. And please be present and engaged in all the topics we are presenting. We're going to be monitoring our WebEx Q&A throughout the webinar for questions and comments, and then we will be sharing out these slides as well, as I mentioned prior to the meeting. So again, this slide just tells you a little bit more about what to do if you are on, on your computer or your phone and you have the chat feature in your WebEx, program. You can chat to all participants, or you can actually ask a private question. Sometimes folks may not be comfortable sharing within the larger group, but we'll be fine sending a private question. If you want to ask a private question, we ask that you use the chat section in the bottom right corner of the screen and sending it to all panelists, which will alert myself and the other panelists online. It will not go out to the whole group, but if you want to ask a question, you'd like input on, and you're fine with having it kind of public for the whole group, you can just use the Q&A section in the bottom right-hand corner. So this evening, we're going to be discussing these topics. We're going to go through general understanding of the influence of cultural beliefs and values that can impact healthcare decisions and vaccination choices. We want to recognize the historical racism, bias, and discrimination that can impact vaccine hesitancy, which is basically the aversion or maybe the hesitance to get a vaccine within the Black, Indigenous, and people of color communities. And you will see BIPOC or BIPOC or hear it within the presentation, and that is an acronym for Black, Indigenous, and people of color. We'll also learn about health inequities that exist today in the ESRD community, how they impact patient care decisions, and how to overcome these challenges. We'll also discover the science related to the development and trials of the COVID-19 vaccine and understand the safety and benefits of obtaining the vaccination. We'll also provide you with a list of credible resources to become educated and make informed decisions about COVID-19 vaccinations. And then we're going to hear from our patient subject matter expert, Renita Peck, who has received both shots of her COVID-19 vaccine. So she can tell you a little bit about that process and her general viewpoint. As we have stated previously, you may have heard us talking to Dr. Krishnan, a nephrologist from Metro Health Medical Center. Our colleague Deb DeWalt will be introducing her again a little bit later in the presentation. And again, we'll also be hearing a viewpoint from one of our patients who has received a vaccine. So we thank both Dr. Krishnan and Renita Peck for joining us this evening. So the first section we'll go over is just the overarching cultural implications that can impact vaccination. So what is cultural values and how do they impact healthcare decisions? Culture is basically can be described as a group of traditions, habits, or customs that are shared or can be observed by others, as well as ideas or beliefs, customs, knowledge, and values that are handed down from one generation to the next in society. And values, what are values? They're core beliefs and practices, and each culture possesses its own particular values, traditions, and ideals. Cultural groups can endorse shared values, either in favor or against something. And generally, we see that cultural values are formed through environmental adaptations, historical factors, social and economic evolution, and contact with other groups. So how do we honor cultural values and beliefs in healthcare decisions? Cultural beliefs can affect how a patient will seek care and from whom, how they will manage their own self-care and make health choices. They can also play a role in adherence, so a person's willingness to adhere to a doctor's recommendations. Also, we talk about shared decision-making, which is a key component of patient-centered healthcare. It's a process where clinicians and patients work together to make decisions like selecting tests, treatments, and care plans based on clinical evidence that balances risks, benefits, and expected outcomes with patient preferences and values. So we see in the course of working in outreach on a day-to-day basis that differences in culture can inform viewpoints about medicine and medical care. As I stated, all cultures have a system of health beliefs to explain what causes illness, how it can be cured or treated, who should be involved in the process, and cultural viewpoints on medical care, coupled with historical experiences like societal bias, can also affect how patients view the vaccine for COVID-19 and its safety. In general, cultural, social, and familial influences can shape attitudes, beliefs, perceptions, and definitions of health and illness, and can impact health literacy. So it's the ability to understand what's going on with you and your health, and ultimately impact health outcomes. So we have our first poll question for those folks joining us online. Do you think your cultural values have influenced your healthcare decisions? The poll is up now, and we will leave the poll up for about 60 seconds. We will close it out, and we will report out the results. Okay, we have about 30 seconds left. We really want your viewpoint, and we want you to join our discussion this evening. So please, if you haven't already, and you can, we have a few folks in progress of answering the questions, so we will give you a little bit of time. You have about 12 seconds. Okay, the poll is now closed. Okay, Janine, can you share out the results for, with folks? I can pass you the ball if need be.
Okay, Laura, I have closed out the poll, and I did post out the results. Thank you. We had 18 individuals that participated, so thank you for those that joined the virtual discussion. We do have 9 individuals, about 50% of those saying yes. 6 individuals, so about a third, 33%, saying no. And then 2 individuals that were not sure at around 11%. So thank you guys for participating, and we encourage you to join the chat discussion as well and kind of share some of your feedback on what's been covered so far.
Thank you, Janine, for that update. So I'm going to turn the presentation over to my colleague, Danielle Andrews, and I will pass her the ball. And she will be talking about recognizing the influence of historical events in cultural impact and decision making.
Okay, hi everybody. So I'm going to really kind of talk about cultural challenges and healthcare misconceptions to start us off. So as previously stated, BIPOC is an acronym for Black, Indigenous, and People of Color. So historically, the BIPOC communities have experienced ongoing societal discrimination, racism, and prejudice, especially within the American healthcare system. These past traumas have made it a little bit difficult and has created hesitancy for the BIPOC population, especially in regards to receiving the COVID-19 vaccine. So there are some common misconceptions that have been associated or stigmatized for patients of color. One is that Black patients exaggerate their pain and have a higher tolerance for pain. That is based on the assumption that some Black patients have thicker skin or less sensitive nerve endings. There is also the belief that Black patients have a higher tolerance to heat and a stronger immunity to illnesses and that they're built for labor. And then there's the internal biases that have associated people of color with drug-seeking behavior, so in some cases when a person of color does go to a hospital for pain management, they may be overlooked or they may have to go through more intense testing versus other individuals. So what can we do as a community to overcome medical mistrust? So it's important to know because there's been so many years of systemic prejudice or systemic racism, as an overall community, we have created protective factors. And protective factors are conditions or attributes in individuals, families, communities, or the larger society that mitigate or eliminate risk in families and communities. So I want you to think in terms of the African American community, Hispanic community, Asian community, overall in general. One big protective factor is the centralization of family and extended family. And a lot of times family acts as a protective factor. So in some cases, if there is an elder that has received this vaccine and they tell you that everything is okay, there is a higher likelihood that the individuals in the family who have a great respect for these elders will then follow suit and get the vaccine. Family acts as a centering factor, and it does control a lot of the cultural values that people have in the traditional social norms. So we all need to be sensitive and aware of the cultural implications, which include values of family, community, religion, gender roles, health beliefs, perspective of death, illness, and medications when we're talking to individuals of different BIPOC communities. So again, we're going to talk more about some historical evidences of medical racism. One big one that a lot of people know is the Tuskegee syphilis study, which occurred from 1932 to 1972 in Macon, Mississippi. So basically, there were 600 Black men that were involved in the study. 399 of them had syphilis, but they were told that they were being treated for bad blood, which can range from anemia to syphilis, anything that would cause any type of disturbance within the blood or the immune system. If they participated, they were promised free medical exams, rides to and from the clinics, meals on examination day, free treatment for minor ailments, and in the event of their death, they were told that their wife or family would receive a stipend. They were never given the option to quit the study, and they were never told that they were being treated for syphilis explicitly. So as the study conducted and kept going, people began to die. They were guessing anywhere between 28 to 100 individuals did die of syphilis. They did also said that some of the wives of the men that were in the study did also receive syphilis, and then it was also passed on to newborn babies. But the intent of the study was to actually see how syphilis progressed in the Negro man versus the majority of the population. Another historical event is the Havasupai tribe, where they are located in the bottom of the Grand Canyon, and they were experiencing high rates of type 2 diabetes. So they worked with, I want to say, Arizona University to do a study to figure out if they were had a genetic disposition to type 2 diabetes. Because of the type 2 diabetes, a lot of the members of the tribe had to get legs amputated and they were on dialysis, meaning that their location of their reservation was no longer plausible for a lot of these sick patients. And without their consent, the university then used their DNA and their genomes in other projects. And then lastly, another historical event is eugenics. And eugenics can be summed up in a variety of different ways, but basically it is the practice of advocacy or improving the human species by selectively mating people with specific desirable traits. So if you were seen as unfit, they did not want you to reproduce. So that included individuals with diseases, mental illnesses, immigrants, people of color, and the poor. So what has been done to protect patients from medical harm? So the Belmont Report was created in 1974 to identify the basic ethical principles that should be taken into consideration when biomedical and behavioral research, including human beings, are conducted. So that includes respect for persons, beneficence, and justice. So basically, because of the implementation of the Belmont Report, patients now have to provide informed consent. They have to be given the option to quit the project or the study whenever they want. They have to be given the pros and cons of the study. They have to know exactly what the study is. They have to be proven competent to participate in the study. Basically, the Belmont Report places a higher emphasis on human life versus medical advancement. So there's also been civil rights enforcement. The Office of Civil Rights has the enforcement authority with respect to health programs and activities that receive federal financial assistance from the U.S. Department of Health and Human Services or its agencies, or are administered by the HHS, or any entity established under Title I of the Affordable Care Act or its amendments. In the event that you feel like you have any issues with civil rights, you can file your complaint at the link below, or you can also contact your ESRD network for support. There's also the Civil Rights Act of 1964, which protects beneficiaries from discrimination based on race, color, and national origin. No person in the United States shall, on the grounds of race, color, or national origins, be excluded from participation in, be denied the benefit of, or be subjected to discrimination under any program or activity receiving federal assistance. Again, this is highlighting the IPRO ESRD network. Your network can work with you and your facility to help resolve your concerns or grievances regarding care received by your facility. Before filling out a grievance with your network, discuss your concerns directly with a staff member at your facility. Ask to speak with someone with whom you feel comfortable sharing your concerns. If you do not wish to identify yourself, ask about an anonymous grievance and how it can be filled out. If you do not feel comfortable filing a grievance with your facility or you feel dissatisfied with the response of the facility staff to your concerns, you have the right to file a grievance with your network and your state agency. To learn more about our grievance process, we do have the link posted below. So building vaccine confidence within communities of color. Vaccination hesitancy is defined as a delay in acceptance or refusal of vaccine despite availability. Questions and hesitancy about the COVID-19 vaccine are part of a larger historical framework of mistrust of the American healthcare system by communities of color due to long entrenched biases, discrimination, and systematic racism. The COVID-19 pandemic has magnified historically embedded racial, ethnic, and social economic inequities for patients and communities of color. Widespread concerns are known to exist in communities of color regarding the safety and equitable participation of diverse populations during pre-production and testing of vaccines. So how can we promote vaccine confidence through community engagement? Here are some strategies to help overcome and help push vaccine confidence. So the first thing you want to do is create a safe space through the establishment of common ground and a validation that the history is real and that people experience hesitancy because of these past experiences. So as a staff member or even as a peer mentor, you should move forward with empathy. Be able to put yourself in their shoes, even though this may not be your experience. You also want to have staff members that are representative of the BIPOC community. And then you should move forward with facts to help dispel myths and misconceptions about the vaccine and how it was developed and how the trials were conducted to help patients feel more comfortable through being more informed. You want to build trust within interdisciplinary teams and providing information about vaccine importance. This can help mitigate gaps in vaccine uptake. You also want to create mechanisms for vaccine distribution that incorporate cultural norms and address barriers such as vaccination sites that address off-work hours and transportation access, as well as identify any barriers to vaccinations, acceptance, and other appropriate healthcare interventions if necessary. So now we're going to go into the chat check-in. So in the event that you do want to answer a question, please fill it out in the chat section below. What is influencing your decision regarding the vaccine? And where do you get your information about the vaccine? Please type your answers in the polling section. I think it's only up for 60 seconds.
So Danielle, it looks like we've got a good number of individuals that are in progress with taking the poll. You can either do the poll, or if it closes out, we can also share this, these responses in the chat as well. So we'd love to hear from you.
So the poll is closed. Do we have any answers to share, or should we continue on and then come back to it?
So I'm tabulating responses now. It should take about 10 seconds, and then I will display them for everyone.
Okay.
Okay, are you able to see the responses, Danielle?
I cannot. I can only see the question.
Okay, so I do have the responses that have come through. So in terms of where do you get information about the vaccine, individuals responded either online, through the news, state and local health departments. They look for credible scientific sources, trusted information that's coming from their medical providers, the CDC, following their doctor's advice and their nephrologist, as well as talking to their peer mentors. So really great comments that have come through. Thank you to all that contributed to the poll. And then I'm just going to tabulate the second poll question. So if you do want to proceed, Danielle, we can do that. And once it tabulates, I'll let you know.
Okay, no problem. Thank you. Okay, so now we're going to talk about overcoming health inequities. So according to the World Health Organization, health inequities are systematic differences in healthcare outcomes. Social determinants of health are conditions and places where individuals live, learn, work, and play that affect a wide range of health and quality of life risk and outcomes. Health inequities are differences in healthcare statuses or in the distribution of health resources between different population groups arising from the social conditions in which people are born, grow, live, work, and age. So one big health inequity is neighborhoods and physical environments. Racially and disenfranchised groups are disproportionately affected with access to adequate housing, food deserts, reliable transportation, and there are some areas that are prone to environmental racism. We can see environmental racism in places like Flint, Michigan, and their water crisis. Another health inequity is health and healthcare. A lack of access to quality healthcare, health insurances, and culturally responsive healthcare systems limits the effectiveness of preventative medicine and increases the likelihood of disease and prevention among the BIPOC community. Income and wealth distribution. Historically, disenfranchised minority groups are disproportionately impacted by poverty, largely due to unequal wealth distribution and larger debt. And then education. People from racially and ethnic minority groups are disproportionately affected by inequities in access to high quality education, which can lead to lower literacy and numeracy rates, lower high school completion rates, and barriers to college entrances. Within the American schooling system, schools are funded by local taxes. So depending on how nice your neighborhood is will determine how much access you have to newer and advanced resources. So viewpoints about vaccinations that can exist in BIPOC communities. COVID-19 has magnified historical racism disparities and inequalities in community of color, which can result in vaccine hesitancy. Anticipation of negative experience when interacting with health officials due to negative interactions in their past. Another viewpoint is expectations of the existence of oppression of harm. The negative, marginalizing, and demeaning experience within the healthcare system can fracture patients' trust. Aversion towards blood and needles, common among cultures with strong holistic-based medical beliefs, and multi-generational mistrust of authority or formalized systems. So how to combat health inequities? Combat health inequity relies heavily on governmental resource allocation, improve access to resources, and the standardized educational system within the community and healthcare team. Here are some things your healthcare team can do to help increase health equity. One is create a safe space free of shame or judgment of a patient's healthcare knowledge. It's very important to understand in terms of health equity, not everybody is starting from the same standing ground. Everybody is not going to have the same access to healthcare information as another patient. And sometimes patients will create coping skills to hide the fact that they are unaware of their illness. So engage in open communication using active listening techniques. This will help patients feel like they're being listened to and that they're being understood. Clearly describing a patient's illness and treatment without the use of medical jargon. Also, having the patient repeat back their interpretation of their illness and ongoing treatment with the medical staff, filing in for the gaps to provide further clarity. So when a patient is repeating what you have said to them or their illness or their interpretation of their illness, the medical staff can then fill in the gaps where the patient may not have fully understood or may have missed. Because a lot of times, as we've heard from a lot of patients, when they are receiving treatment information, some things do get lost. So filling in the gap can be very helpful. And then creating responsive healthcare plans that attest to a patient's specific healthcare barriers while providing them with a complete picture of possible treatment options with a list of treatment providers, pharmacies, and supplies needed. So it's important to really understand when you're creating a healthcare plan where the patient lives, asset mapping, what if they have access to a local pharmacy, if they have access to a local supermarket, if they have access to fresh fruit, to help make sure that they're following their treatment plan, and if necessary, how alternatives can be incorporated. So before we move forward, Janine, do we want to go back to the poll results?
Yes, thanks, Danielle. So there were a couple of comments that did come through. Individuals kind of indicating in terms of what influences their healthcare decisions around culture. A lot of people kind of in that indifferent mode. They're not really sure, waiting for more science, looking at comparisons to the flu shot and if they've had any allergic or adverse reactions to the flu shot and not knowing enough about the COVID vaccine. There were also some comments around, particularly for ESRD patients, the risk for immunocompromised patients, and just not having enough data for ESRD patients. So really great feedback, and we appreciate everyone kind of sharing your thoughts with us.
Okay, guys. So thank you for sharing with the poll questions. Now I'm going to pass it over to my colleague Janine Pilgrim, who's going to discuss the importance of vaccination.
Great. Thank you so much, Danielle. So I'm going to start us off with another poll question because we really like to hear from all of you that are on the line. We appreciate you taking time to join tonight's webinar. And so before we kind of go into the portion of today's program that's going to talk really about the importance of not just the COVID vaccine, but vaccinations in terms of healthcare, I did want to get a sense for those that are on the line, if you've received your flu shot this season. So either yes, no, or maybe you're not yet, but you're planning on getting it. So I'm going to launch a poll. It's going to go for 60 seconds while I go through some information, and then we'll circle back and check out the results. So as we kind of think back to all the information that Danielle and Laura have shared in terms of how culture, different values, belief systems can impact our healthcare decisions, particularly thinking about us all living this past year through the COVID-19 pandemic, and now we're all at the moment in the juncture of considering this COVID-19 vaccine. Really wanted to make sure that everyone understood what exactly is a vaccine and why are they important. So a vaccine that is injected is really designed to stimulate your immune system to produce antibodies to attack and kill that particular virus. Vaccines teach your immune system how to create antibodies to protect you from different diseases. And that's why there's different vaccines for different diseases. And particularly tonight, we're talking about the COVID-19 vaccine. Our immune system is designed to help to defend any of the invading organisms. If there's a new virus that's attacking our body, our cells, that is a function of our immune system. It's stimulated to make sure that we have specific proteins, which are antibodies, that are going to recognize the virus particles, attach to them, attack them, and destroy them. And that's why it's important for us to get vaccines for particular diseases. You can kind of think of a vaccine as a way to jumpstart your immune system to produce these antibodies. So it's a preventative measure. We want your immune system to be ready. So should you be exposed to that disease, your body has almost had some practice in developing those antibodies that are going to be able to defend you and attack those virus cells. Now, why do you might be thinking, well, why are vaccines important? And particularly for our patients that are all on the line and in our ESRD community, vaccines really are your best defense against serious diseases. The COVID-19 vaccine may be new, but vaccinations are not. And many diseases have been eliminated in the United States as a result of vaccination programs. And some examples of those that people may be familiar with is polio, smallpox, measles. Vaccinations are safe and effective. And I know based on some of the poll, comments that we've gotten so far tonight, maybe some uncertainty or not enough information just yet on the COVID-19 vaccine. And we really want to reassure everyone on the line that all vaccines undergo really long and careful reviews by scientists, doctors, the federal government to make sure that they are safe and FDA, approved before they are administered in the community. And Dr. Krishnan is going to be talking in greater detail tonight so we can really understand the COVID-19 vaccine. Vaccines are not going to give you the disease that they're designed to prevent. They do work better the more people that get vaccinated. So you may be hearing on the news about, herd immunity, passive or active immunity. And so it's really important to educate and inform yourself on why vaccines would be important and why you should be considering the COVID-19 vaccine as we all continue to live in this pandemic. So that's really to just kind of set the tone for the presentation that we're going to be moving into. And I did get the poll results, so I want to just share those results and do a quick check-in to see if anyone has questions or comments for us. So if you do have any questions, thoughts that are coming to mind on anything you've heard so far, whether it relates to the importance of vaccines or any of the areas that Danielle and Laura have been sharing in terms of the cultural implications, please chat them in. As Laura said in the beginning, you can do a private chat to the panelists, which is our team at the IPRO Network program, or you can share them with your peers and everyone that's on the line via a chat to all participants. If you do have a question, you can use the Q&A box And we're also going to have a couple other polling questions as we continue tonight to get your feedback. So I'm really pleased to see that 22 individuals took that live poll question. And the majority, 73%, have indicated yes, that you have already gotten the flu shot, so that's excellent, especially considering all those benefits we just talked about for vaccination. I do see that there's 2 individuals that haven't got it yet, but they do plan to get it, which is great to hear, and 2 individuals that haven't gotten it yet. So hopefully after tonight's presentation, you'll feel more informed about vaccination and plan to get perhaps your flu shot as well as the COVID-19 vaccine. So with that, I'm going to just ask Danielle or Laura if there are any questions that have come through in chat before we switch gears to our guest speaker.
Hi, Janine. I've looked through the chat. I don't see any questions.
Okay, great. No problem. So we'll keep our program moving along, but please don't hesitate. We really want to hear from you. It's difficult to open all the lines to the vaccinators, but that doesn't mean we don't want to hear your interaction. So please, if you're able and you're on a device, chat us a comment, a question, join these live polls because we really love hearing from you. So with that, I am going to turn the floor over to Deb DeWalt, she's a Quality Improvement Director at the Network Program, and she has the pleasure and honor of introducing our guest speaker for tonight. Deb?
Thank you, Janine. We are very honored to present our next speaker, Dr. Krishnan. Dr. Krishnan is a pulmonary care, critical care, and sleep physician at the Metro Health Medical Center in Cleveland, Ohio, and holds teaching positions in these specialties at the Case Western Reserve University Medical School. We are very pleased to announce today to the whole community that Metro Health Systems, as recently as yesterday, was recognized as one of the most ethical companies in the world, with recognition in their work regarding community transformation and social determinants of care, of health, which is very timely and poignant to this presentation. Since the pandemic, Dr. Krishnan has taken on the role of research investigator in 2 multi-center and multinational studies on the COVID vaccines and has provided education for the community on COVID-19 and its vaccination. Dr. Krishnan also is the chairperson for the American Thoracic Society Patient and Family Education Committee. And we're very pleased and honored to have her with us and sharing her wisdom. Thank you.
Thank you, Deb. And thank you, all of you, for inviting me to speak here. That information about Metro Health being an ethical place to work was news to me, but it's not surprising. It really is a great place to have spent the last 14 years of my professional career. And I was really pleased to accept this invitation because I think this topic of COVID-19 vaccination has been overwhelming my professional experience here in the last year, and particularly in the last couple months since the vaccines have been available for authorized use since December. So I think the hope to contain the spread and severity of the COVID-19 disease that's caused by this novel coronavirus, it's what's motivating us to promote the importance of the vaccine. But I really applaud the content of this entire seminar because I think putting this vaccine into the context of previous endeavors for vaccinations and scientific research, it's really plays an important role in why we do see some vaccine hesitation in not just the BIPOC community, but really with other healthcare workers and individuals as well, and why we want to promote the science behind the vaccines. So I will take the next slide.
Actually, we have a poll question. Janine, do you mind? Do we want to do this now or kind of, I guess we're doing it.
I'm locked and loaded, Laura.
Okay.
So you guys are now pros at this. So 60 seconds, I'll do a check-in at halfway, and I already see some individuals providing responses, which is great, and they're coming in quickly.
Yeah, and the question for those on the phone is, do you feel the COVID-19 vaccine is safe for ESRD patients?
So we've got about 30 seconds left, and it does look like we've got 13 individuals that are in progress and 17 that have already completed the poll. So that's really great interaction to see. So just another 15 seconds, and then I'll tabulate the results, and I will display them out for everyone. Okay, great. Thank you all so much for taking this poll question. I'm very encouraged to see, Dr. Krishnan, that 80% of individuals that responded did say yes, they do feel that the vaccine is safe. We do have 20% that said no, that said not sure. So hopefully you'll be able to turn that around maybe after your presentation once you share a little more information about the COVID-19 vaccine.
Sure, I will try here. So the first part of this is really just understanding the COVID-19 vaccine and why it's important. The importance of being vaccinated was covered by our previous speakers as well, but in general, for a vaccine to work, the greater the number of people in the population that's vaccinated, the better the vaccine will provide immunity to the entire community. This is the concept of herd immunity, and depending on how the virulence and how fast the spread of the virus is, somewhere between 65 to 75% of the population needs to be immunized in order to achieve that herd immunity. The other important reasons would be to protect yourself, your family, your loved ones, and your patients that you're interacting with in the dialysis centers. Vaccinations are a safe way to build immunity against the virus. And like I said, it's the promise of a future new normal that can help stop the pandemic is really a motivation for all of us. Next slide. The CDC has put out guidelines as to how to triage people who would like to get the COVID-19 vaccination. The green section are people who can proceed immediately with vaccination. The yellow section is talking about people who may need precautions, but it's still safe to get the vaccination. And then the red section are really the people who should not get the vaccine. I think what is most important here is that the conditions that are contraindicated from getting the vaccine just simply do not exist. There were the studies from the vaccine trials included all patients with all conditions. They initially excluded pregnant patients and lactating women. However, even in those trials, they ended up being included somewhere down the line, and the science behind the immunity suggests that antibodies developed from this vaccination against COVID-19 are similar to other antibodies that are protective of mothers and their babies. People who may be more cautious of getting the vaccine are people who have moderate to severe acute illness, patients who are in the hospital for whatever reason, and certainly patients who are actively infected with COVID-19 vaccine. Those you may want to speak to your provider about potentially deferring the timing of the vaccine, not to avoid it completely, but just to get over the acute illness before getting the vaccine. But like I said, conditions that can proceed with vaccination, with pregnancy, lactating women, and even immunocompromised patients are all safe to get the vaccine. And the general recommendation is to monitor patients for about 15 minutes after they receive the vaccine for any side effects. In people who have allergies, a history of allergies unrelated to the components of the vaccine or unrelated to IV medications in general, those people are fine to get the vaccine. Out of an abundance of precaution, the recommendation is there for a 30-minute observation period after getting the vaccine instead of 15. However, all of the studies who have included these patients have seen a substantial safety signal that would that makes the recommendation safe. For people who do have allergies to IV medications, those people may want to defer the vaccine until they can consult with an allergist or immunologist, or depending on how well they know their reaction, they may choose to go ahead with the vaccine with that longer 30-minute observation period. The only people who really should not get the vaccine there are people who have severe allergic reactions to the first dose of the COVID-19 vaccine or to a particular component of the vaccine, the polyethylene glycol. And those it's a very small subset of people. Those are the people that we do not recommend vaccination. So, okay, and I'm seeing the slide for who should consult their physician prior to vaccination. And as is listed, the people who have a history of prior reaction to vaccines, and those are vaccines that are injectables, persons with previous history of allergy to polyethylene glycol, people who carry an epinephrine injector. And like I said, anaphylaxis is a major type of allergy, but it's particularly anaphylaxis to injected materials that is the factor that we're looking for to be more cautious with the vaccine. In cancer patients and other patients with immunosuppression, it's actually, we're more and more comfortable saying that they should get vaccinated in order to prevent additional infection. Pregnant and lactating women, like I said, the recommendation now by the OB, the obstetrician gynecology major societies is that they should get vaccinated, and then other complex and acute illnesses. You can go on to the next slide. So how to proceed with the vaccine after you if you have gotten the COVID infection. I already mentioned during the active illness is not a good time to be vaccinated. In that situation, as you're actively infected, your body is also mounting an immune response to the infection, and so you are developing immunity and the antibodies. Vaccination should be deferred until recovery from the COVID disease, and isolation is discontinued, so after 10 days minimum or symptom-free. There's no minimum amount of time between the infection and the vaccination that is recommended. The CDC does advocate for somewhere between 2 weeks to 90 days after the vaccination. People who have gotten active COVID infection have developed antibodies, but it's not completely clear how long the immunity lasts. Around 3 to 6 months after the infection, it's thought that that immunity sort of subsides, and that would be the opportune time to get vaccinated. And there are some websites there that can reinforce those ideas. So the two vaccines that are available that are authorized in the U.S. is the Pfizer and the Moderna vaccines. Both of them are a series of 2 doses. Pfizer is 3 weeks apart. Moderna is 4 weeks apart. Pfizer was studied in people aged 16 years and older. Moderna was 18 years and older. And both of them had very similar efficacy rates, more than 90%, somewhere between 90 and 95% efficacy in stopping severe illness. So the thought behind the vaccines is that it may not stop infection completely, but it gives sufficient immunity to stop the severity of the illness that is causing so much morbidity. The testing sample, 18 years or older, included all ethnicities and races and comorbid conditions, and that included chronic kidney disease, but the test sample actually did not include the end-stage renal disease patients. The safety data in end-stage renal disease, like in pregnant patients, is extrapolated from the antibodies that are created and how these patients have responded to previous vaccines. The mRNA vaccine should be administered alone. So if, for those of you who are still waiting to get your flu vaccine, you should have at least 14 days between the flu vaccine and getting your COVID-19 vaccine. And the vaccine safety profile has been similar to all the other vaccines. There in particular, conditions like Bell's palsy was particularly looked at in these vaccine trials. And the rate of Bell's palsy was the same in both the control group and in the group that received the vaccine, suggesting that Bell's palsy is a condition that's out there, but it's out there independent of the vaccine. Local reactions seem to be a little bit more common. Somewhere between 50 to 70% are endorsing some pain, some local pain at the site of the injection, and particularly with the second dose, because the second dose of the vaccine is when your immune response is really boosted by re-exposure to the spike protein. Next slide. So how this mRNA vaccine works is that the vaccine itself contains the coding for the spike protein, which is the protein on the surface of the coronavirus that allows for the virus to enter cells. So that spike protein is the target of the mRNA vaccine. And once the vaccine enters the antigen-presenting cells, then within those cells, the vaccine, the mRNA, is encoded into protein. It never actually enters the nucleus, and so it never even comes close to the DNA. There's, we'll talk about facts and fiction, but this concern that the mRNA can integrate into your DNA, it's simply not possible how it is functioning. It's a very effective way of your body creating this protein, and so this foreign protein basically in your body, it creates sufficient amounts that your body will start developing a robust, strong immune response to that spike protein. Next slide. Yeah, so exactly. So some of these, facts versus fiction. So one fact is that the mRNA vaccine, it doesn't include the live virus at all. So you cannot catch COVID-19 from these vaccines. It is coding just for that specific protein, the spike protein, these two, Pfizer and Moderna. The vaccine does not affect or enter the recipient's DNA in any way. It doesn't even enter the nucleus, which is where the DNA or genetic material is kept. And then once the mRNA enters the cells and protein is created, those cells will apoptose. They actually break down on their own to get rid of that mRNA, so there's no residual effect. Next slide. The CDC has good resources if you're looking to learn more about the mRNA COVID-19 vaccines. It's on their CDC site, and the links can be provided. I'm sure many of you have also heard that the Johnson & Johnson vaccine is moving closer towards getting authorized here as well. And if you're interested, we can talk a little bit about the differences, but that will be yet another option for getting the vaccine. So, next slide. So a big myth is that there was the speed by which these vaccines were went through the scientific method was too fast, and we don't have enough information. So really, what is the truth is that all the vaccines still need to go through the rigorous scientific process to get the authorization by the Food and Drug Administration. Because this was a public health emergency and a pandemic, most of us have not lived through the need to develop a vaccine so fast, nor have science been able to create a vaccine so fast. But once it has the science behind the mRNA vaccine actually started years ago with the SARS infection and the Middle East respiratory syndrome infection. That was over a decade ago. So the science has been worked on from then. The particular COVID-19 vaccine that has been created in the last year still had to go through the different phases of trials. But what was unique is because it was a public emergency, the phases were able to be expedited. There was review of the data immediately after each phase was finished, and there was overlap. Phase 2 trials, and I'll get to what these are, happened simultaneously while phase 3 trials began, so that we were able to collect all the data simultaneously. Yeah, next slide. So the FDA standards for vaccine safety goes through this rigorous process of, like I said, first in the laboratory testing to develop the molecule, which happened over a decade ago. If there was promise for the vaccine, then they undergo animal testing for safety data and efficacy data. And only if it shows promise at that point, it enters clinical trials in human subjects. A phase 1 trial involves somewhere between 20 and 100 healthy volunteers, where they give small doses of the vaccine and with increasing dosing to look at the side effect profile and the safety profile for the vaccines. Phase 2 involves several hundred healthy volunteers, where now they're continuing to study the side effects and the safety profile, but now they're fine-tuning the dosing and learning more about the immune effect. And then the phase 3 trials are the ones that included thousands of volunteers. These are randomized controlled trials. That's the highest level of evidence in clinical trials that produced information about comparing the vaccine versus not getting the vaccine, and then looked at, continue to look at the safety, the side effect profile, and the effectiveness. So these vaccines are going through all of these trials, these stages. And the Pfizer vaccine, the phase 3 trials involved over 40,000 people. The Moderna vaccine trials involved close to 28,000 people. So really large populations. Next slide. The fiction that this vaccine has severe side effects, but the facts is, going back to the phase 1, 2, and 3 trials of the vaccine, 80 to 89% of the trial participants reported no reaction at all, or just a local reaction, like pain or swelling at the injection site, lymph nodes on the same side as the vaccine. less 55 to 83% of clinical trial patients reported none or maybe one systemic reaction, which included fever, fatigue, muscle aches, headaches, chills, not unlike other vaccines. And the people who get those symptoms are really displaying a vigorous immune response, which is what you want to see that the vaccine is actually working. Most of the side effects are mild to moderate in severity. They occur in the first 3 days, and they resolve within 1 to 2 days of onset. The recommendation is not to premeditate with anything, but if you develop these systemic reactions, you can take Tylenol or Advil, Tylenol in the to help with the symptoms. The more frequent and severe reactions tend to be among the younger age groups who have a more robust immune response. Next slide. And to dig deeper into those severe reactions that have been reported from the, I believe that's from the Pfizer trial, that there's the 21 cases of anaphylaxis that were reported out of 1.89 million doses that were administered initially. So that was 11.1 cases per million doses that was given. Of those 21 cases, 17 of them had documented history of allergies and allergic reactions of prior anaphylaxis with IV medications. And that's why the CDC has some caution for those people who display that reaction, but it was still very rare. The median interval onset of symptoms was 13 minutes, which is why the CDC recommendation for these vaccines is to observe for at least 30 minutes. And the follow-up that is available for 20 of the persons affected, all of them recovered. Next slide. And this was connecting back to the beginning of the presentation and the speaker's interest in the diversity and how whether the vaccines were adequately studied in a diverse population. So this slide is looking at the diversity of the U.S. population at large. That's that first column of numbers. The total population of adults age 16 years or older. And then comparing those that were participants in the Pfizer or Moderna vaccine trials. In the overall population is about 73.6% white, 12.3% black. In the vaccine trials, Pfizer had 81.9% white and 9.8% black. Moderna had 79.4% white and 9.7% black. So both the vaccine trials did include less black patients, black people in the population compared to the general population. But if you look at all of the scientific data that's available, these trials have achieved greater diversity than most of the previous trials for any other drug. In both COVID-19 vaccine trials, the demographics and of the placebo and vaccine groups were similar. And so the differences of reactions that occurred between the two populations could be compared with confidence. So the similar vaccine efficacy results were observed across racial and ethnic groups in both the Pfizer and the Moderna trials. Next slide. I'm just going back and forth with my computer here, but in December of 2020, the New England Journal of Medicine published the safety data for the Pfizer vaccine. And according to the study, the vaccine efficacy is similar to that observed in the overall population, was generally consistent among subgroups defined by age, gender, race, ethnicity, obesity, or the presence of a comorbidity. So the vaccine efficacy, the sensitivity analysis that they did across these vaccine trials show that it was a consistent reaction, a consistent response to the vaccine that was being seen regardless of age, gender, race, ethnicity, obesity, and presence of comorbidity. I think this is a really comforting finding. It's not the end all, and of course, ideally we'd want to study each of these populations individually, but the fact that they were able to include a diverse group into these vaccine trials makes the safety and efficacy data something that we can apply across multiple populations. Next slide. So I guess this is some more information about the Moderna COVID-19 vaccine. Information on the safety and efficacy of the Moderna COVID-19 vaccine can also be found on the CDC website. The CDC has data the outcome of trials, as well as the demographics of the patients. But it's a similar finding to what we just went over with the Pfizer vaccine. Next slide.
Okay, so we are going to now launch to a Q&A with Dr. Krishnan, but while we're talking, we have a poll for you. The poll question is, once I'm eligible to receive a COVID-19 vaccine, I plan to be vaccinated. Janine will put that up on your screens for those on devices or computers, and you have 60 seconds. I'm going to turn it over to my colleague Deb, who will be asking some of the questions that were put in chat for the doctor. Deb?
Thank you, Laura. Dr. Krishnan, the first question comes from the chat, and one of the participants on the call wanted to know if the COVID-19 shot how it could adversely affect kidney patients, or would it adversely affect kidney patients, or perhaps worsen their kidney function. Is there any input that you could give on that question?
So in terms of worsening the kidney function, I can look back to the two major trials for the vaccines, and that would have been a side effect that they were looking for in the trial. So there's no reported worsening of renal function with these vaccines.
That is so good to hear. Another question
I'm sorry, the first part of that question about is there any other problems? I will say with patients who have nephrotic range proteinuria and they're spilling protein, they may, the vaccine may not be as efficacious, but that doesn't mean they shouldn't get it. They'll have, even the partial immunity is better than no immunity.
Thank you. Yes, I hope that helps the participant. It's really good to know that kidney function was looked at during all of the trial. The second question is oral medication allergies. When one of the participants went to get their COVID-19 shot, they asked specifically if the patient or participant had any allergies to oral medication. Is there a reason why they're curious regarding why they would ask about oral medications when it's actually mostly IV medication allergies that we are worried?
I think, the more data that's collected, the more reassuring it is that it's reinforcing the fact that allergies to oral medications is not linked to the side effects that have been seen with this vaccine.
Okay. One participant was particularly interested in the J&J shot, the Johnson & Johnson shot, because it's a one-shot, one-stop shop. Is there any decreased efficacy for getting one shot compared to the Moderna or Pfizer shots that are out there now?
Well, the reported efficacy for the J&J shot is somewhere around 70%, so not quite the 90 to 95% efficacy that we're seeing with the Moderna or Pfizer vaccines. But like this participant said, it is only one shot, and so it's probably easier to get this to a larger population. And if you go back to the principles of herd immunity, if you could vaccinate 80 or 85% of the population with a vaccine of that efficacy, you'll probably obtain herd immunity. So there's a role for the J&J. It also has a slightly different mechanism of action. It's not an mRNA vaccine. And so but obviously it's way too early to make any comparisons between the two.
Right. So another participant wondered in the chat, if you have a reaction to the flu vaccine and possibly severe enough to carry an EpiPen, should you not receive the COVID-19 vaccine, or should you consult with your physician, or what would be your recommendations of how to proceed if you've had an allergic reaction to a influenza vaccine?
Yeah, the influenza vaccine, I say IV, but parenteral in general. So I think the injection, if you've had a reaction to an injectable, that would be a reason to consult with your physician. There are some people who it wouldn't be a direct reaction. It might be a cross reaction, which may be less severe than the reaction you had to the flu vaccine, or it may not be at all. And so I think that's something to consult with your physician. They may even refer you to an allergist to discuss more.
And just to conclude our questions, there was a question about the VSafe reporting of vaccination reactions and tolerance. Is there anything that you could speak on the VSafe program?
Yeah, I know. When you get your vaccine, they give you the information for the VSafe program. So if you have any reaction at all, they're asking to log it into the website so that they can track for reactions beyond what was studied from the trials. And so the data from that, to be honest, I haven't gone to the CDC VSafe site recently, but they should be continuously updating that information on the CDC site.
Another question just popped up, and one of the participants wants to know that is the COVID vaccine safe for transplanted patients or patients who have received organs?
So yes, the answer is those patients who have had transplants would be considered in the immunocompromised group that would benefit from getting the vaccine, particularly because they're lower on immunity, that they may have a more severe reaction to COVID. The same would apply to what I said earlier to the renal patients, that if the immune reaction may be a little bit less than those who have a fully immunocompetent immune system, but some protection is better than none. But in terms of safety, yes, it is considered safe.
Well, Dr. Christian, thank you. Would you be willing to stay on for a couple more minutes to see if we have any questions on the phone line?
Absolutely. Sure.
All right, so folks, I am going to attempt to unmute the phone line. We'll see how much noise is out there. We may just have to refer additional questions to us after the program has concluded, and we can pass those along to the doctor. So let me see what I can do here. One moment, please.
Sure.
Okay, the phone lines are unmuted. Do we have any questions for folks on the phone?
Yes. Hello?
Yes, hello.
Yes, this is Roxanne Boyd. I'm from DCI South in Shelby, North Carolina. And the concern with the about being allergic to things or whatever stuff, I know me personally, and I know of several others, that's the dialysis patients that are allergic to like the contrast dye. And myself also with the Ancef antibiotic, and I have had reactions with those. And but is there anything, I know we've touched base on it a little bit, but is there anything specific that somebody could be allergic to that could interfere with, cause problems with this?
Yeah, the main reaction that we're concerned about is with any reaction to polyethylene glycol. And so particularly, and that's a carrier that's used for a lot of vaccines and a lot of drugs. So it's something that can be looked at in previous reactions to other drugs if it was also carrying the polyethylene glycol. But to go back to the question of the allergies, it's not all allergies that are actually concerning. It's really the severe anaphylactic reaction to injectable materials. That's what is linked to this severe reaction.
Okay, thank you.
Dr. Christian, just for the people on the call that may not know what an anaphylactic reaction is, can you just sort of describe that for us? Because I don't know if everybody interprets it the same.
Thank you. Yes. So an anaphylactic reaction is really when the reaction causes a whole body system issue with can cause swelling in the throat, and the throat can close off. The blood pressure can be affected, shock and low blood pressure who are developing anaphylaxis. And they're the ones that need the epinephrine injection to reverse the effects.
Thank you, Dr. Christian. I just wanted to let all the participants know on the call, if you reach out to your patient outreach coordinators or the outreach department with any questions that you may think of after the call has concluded, we can forward those to Dr. Krishnan, and in the past she's been very helpful to provide information regarding late received questions. So thank you so much, Dr. Krishnan. We appreciate your time. I know you've had a terrible time in the ICU this week, so we're going to be respectful and let you pop off if you'd like.
Okay, well, thank you very much, and thanks for the great discussion.
Thank you.
Okay, thank you for everyone who participated on the phone. I am going to mute the lines again so we can get rid of the background noise. And let's see if this seems to have worked. I wasn't sure if it was going to work. We're going to circle back to our poll questions, our results. Once I'm eligible to receive a COVID-19 vaccine, I plan to be vaccinated. Janine, do we have those results?
We do, Laura, and I'm really excited to share actually that we had 15 individuals complete that poll, and 14 of them indicated yes. There's just one that's still not sure. So we're really great to see that participation and happy and hopeful that the information provided tonight can kind of help you make that decision. So.
Thank you so much, Janine. We're going to move on to our patient conversation, and I will pass the ball over to Danielle Andrews to lead that portion of our presentation.
So in this aspect of the presentation, we're really going to get the patient's perspective on receiving the COVID vaccine. And I would like to introduce Renita Peck. She is a patient subject matter expert from Network 9, and she is a member of the IPRO ESRD Network Patient Advisory Committee and Medical Review Board. So thank you, Renita, for coming to our presentation today.
You're welcome. Thanks for having me.
So we're just going to have a conversation, and one of the questions I wanted to ask you was, what prompted you to get the vaccine?
Well, I wanted to get the vaccine because I wanted to get back to some sort of normalcy and be protected. I had so many friends that had COVID that, and they told me, like, you don't want this. It's, it is not a fun thing to have. So that's why I really wanted to get it.
And how do you think race has affected your outlook on the vaccine?
Well, I think it has affected, it affects me with the healthcare in general, but it affects me because, Dr. Krishnan gave us the information on the percentages of the study and how many people of color participated in the studies for the vaccine, and we tend to still be on the lower end. And I'm like, where do we fall? How does that work for us? So I was really concerned at first that, the Tuskegee experiment, which you mentioned earlier, always pops into the back of my mind as well. But, once I did my homework, I felt better about it.
And as we kind of talk about race, how has systematic racism and discrimination shaped your perspective just on the healthcare system in general, as it has become increasingly complex, especially with COVID?
Yes. So as it has been stated before, COVID has really exposed the systematic racism within the healthcare system. Not only am I a patient, but I work for a healthcare company as well. So I see another side of it, and I think that it has made me realize that we as African Americans or people of color, we need to be better advocates for ourselves. We need to speak up. We need to stand toe-to-toe to the doctor. If we don't understand something, we need to ask questions and try to rely on the science and not, the old wives' tales and things of that nature. But the systematic racism, the discrimination, and the quality of care has really come to the front with this COVID pandemic.
And as we talked about old wives' tales, we talked about protective factors, and even having conversations with other patients. If you've talked to other patients or even other people, because I know speaking to patients can be a little bit difficult in the times of COVID.
Right.
Have you heard any concerns about the vaccine?
Oh, yes, definitely. I have friends that I've spoken to about it, and they said they think it's good for me, but they're not sure if it's good for themselves. They're a little skittish about it, and I just try to talk about science again. And then I tell them, if you want to be around me, you're going to have to get the vaccine. If you ever want to see me again in person in less than 6 feet, you're going to have to get the vaccine. But I think more people are coming around, I think. So, but we need to see us. We need to see us talking about the vaccine and not others, so that we know that they can relate to our cultural, the cultural implications. So I just think that that's important.
Yeah, so you're kind of referring to, in order to get patient buy-in, patients have to see themselves reflected within the healthcare staff, the people that are providing the vaccines.
Correct. That is correct. I try to seek out African American or people that look like me when I look for physicians. And I'm not to say that other races or ethnicity doctors are not good, but sometimes I just need to see myself in them and know that they understand, hopefully, my situation, where I'm coming from, that type of thing. You and I talked about before, we're not a monolithic group, but we at least share some commonalities. So
I think our commonalities come from our histories, and that is why we have this collectiveness. The collectiveness is seen throughout the communities. But
that's correct.
to move on to our final question, I know you talked about getting more information. What helped alleviate your concern about the vaccine?
Basically, doing the research. I looked at the CDC website. I listened to our local health department and the leader of our local health department here. Those types of things. The leader of our health department here is an African American woman. So those are the information sources that I sought out. Not Facebook, not Twitter, not any of that, not JoJo down the street. I actually did the research.
So to combat fears, you just informed yourself.
Correct. That is correct.
Patients should seek to further inform themselves to help alleviate their own fears.
That is correct.
Okay, well, thank you so much for answering some of our questions. If patients have anybody on the line has any more questions about the patient perspective, please write it in the chat. And we'll give you guys a few moments to write it in the chat.
And while we wait for questions to come in, I do want to acknowledge, I know we're right at our 6:30 mark, but Laura, perhaps we may want to open the lines again and just see if anyone on the phone line that's not on WebEx might have some questions for Renita. We can give that a shot. It worked out pretty well last time.
Lines are unmuted. Does anyone on the phone have any questions for
I'd like to. This is Kim Pratt. I happen to see my kidney transplant nephrologist for my.
Well, if she can just stay with her until you get to the bus stop.
And I discussed with him about which of all three shots would be best, because I see that there's no live virus in the Moderna and the Pfizer shot, but in the Johnson shot, it's a live virus, but I forget the other word in front of it. It's not. And make a long story short, it seemed to me that I should be being a transplant patient. I should be picking Moderna and Pfizer. One of. You want to call?
Dawson is a lover.
Hi, everyone. We apologize for the noise. If you do not plan to ask a question, please mute your line.
Okay. Did you hear my question? This is Kim Pratt.
I'm sorry, Kim. Can you ask the question?
Okay. I happen to have my transplant appointment today with my knee transplant nephrologist, and I was discussing the vaccine about which of the 3 vaccines would be best for a transplant patient, because I'm aware that there's no live virus in the Moderna and the Pfizer shot, but I'm trying to be clear with the Johnson one. It's got a live virus, but not. There's another word in front of it, so I don't know if it's considered the typical live virus. But from what I gathered from him is he felt I think it would be best to take one of the Moderna or the Pfizer shot. Is this correct?
I am reaching out across my expertise, but from what I have learned about the vaccinations is that the efficacy, which is the effectiveness of the Moderna and the Pfizer vaccine, are at a higher level of immunity, will provide you with a higher level of immunity after the second shot. And being that you are immunosuppressed, it would be best for you to have the highest level of protection, which is what has been demonstrated so far by the Moderna and Pfizer vaccine. But that is all I know because I am not an expert on the Johnson & Johnson shot. It is really a one shot, but it does provide a lesser amount of overall immunity.
I see. Thank you.
You're welcome.
Well, since we are running, we're past our allotted time, I'm going to remute the lines. Again, if you have any additional questions, please reach out to Danielle or myself. We will be happy to forward them on and get those answered for you. I'm going to, take the ball back as the presenter, and then I'm going to talk a little bit as quickly as I can about patient empowerment. We're almost ready to go. Again, at the network, we want to do everything we can to support patients and patients from the BIPOC community. We want to continue to create safe spaces like these meetings, our PAC meetings or PSME meetings, and we do have a biweekly support group, which is run by my colleague Danielle, which is a great place to talk more about your concerns and receive any feedback and resources that can help you. We want to continue to include ESRD patients across the BIPOC community in efforts to suggest and advocate for strategies for improving understanding of culturally competent dialysis care. And then we want to make sure that we support positionality when speaking with patients and take your, your viewpoint and see it from your point of view and take into account, your culture and, what your needs are. As an ESRD patient, you always can do a lot to increase cultural competency in your healthcare. That usually starts with questions. We have a list of questions here that you can ask your providers. You can ask them about if they're familiar with your beliefs, whether or not they have experience treating people from your cultural background, and if you need help with language, you can ask if folks are bilingual. And, as always, we encourage you to arm yourself with the facts. Knowledge really is power in this case. We've given you a lot of information tonight, and I think the resounding sentiment is, do as much as you can to look at your credible information sources, contact providers or credible agencies that work with people from your community, do your research online. If you do have health insurance, you can ask your health plan for providers that match your cultural background in case you feel better or more comfortable talking with someone who looks more like you. So the important takeaways we have for you tonight for patients are, given the known risk of COVID-19 and the infection of dialysis patients, and the data so far that has been available about vaccines, and kind of putting that together, we're urging you to get the vaccine. We think it is a safe treatment to consider based upon the knowledge that we have as an organization and working with doctors and other clinicians and folks in dialysis facilities. As a patient, if you're still not sure, you can tackle misconceptions using the SAFE acronym. S being safe, the risks and side effects are small compared with the benefits. A is for available, based on risk group. F is for free. The vaccine is free, although some providers may charge an administration cost. And also the vaccine is E, effective. Both the Moderna and Pfizer vaccines are approximately 95% effective in preventing COVID-19 disease when administered as directed. That means 2 doses. As was mentioned earlier, the Johnson & Johnson one is very close to being approved, so that will likely give you another option. Additional takeaways for patients as well as providers. For providers, we want you to encourage all dialysis patients to speak with their nephrologist and healthcare team to consider getting the vaccine as soon as it is available. And for patients, if you contract COVID-19 before you get vaccinated, please speak with your nephrologist and consider getting an infusion of monoclonal antibodies that could help you. And for both patients and providers, if you reside in a state that's not currently distributing the vaccine to you or your patients, make sure to contact your state health department and or legislators to advocate for that distribution to your community. And I will throw it back really quickly to Danielle for, I believe, the final part of the presentation. Danielle?
Hi, guys. So we're almost done. I'm just going to go over our available educational resources. So the first one is COVID, flu, cold, allergies. How can I tell the difference? So the network has designed a list of symptoms and how it falls in line with COVID, flu, the common cold, and allergies. There has been some concern about mixing up the symptoms or recognizing whether you have COVID or the flu or the common cold. In the event that you do have some of these symptoms, please note that it is very important to get in contact with your doctor right away. There are some overlapping symptoms, but in the event that you feel that you have COVID, please get in contact with your doctor right away. We also have an important notice: a high-risk patient lives here. This was done by a patient subject matter expert, and it is a poster that highlights the symptoms that are associated with COVID, or if you've traveled, or if you have any of these symptoms. Please recognize that this person is high risk and engage appropriately or disengage if you have any of these symptoms. So then this is a draft that's in development by the ESRD network. This again has been created by the network as well as our patient subject matter experts. This is the COVID-19 vaccine, what ESRD and transplant patients need to know. We are in the process of finalizing it, but it's going to highlight whether the vaccines are safe, it's free, and it's going to really dig in the importance of the 2 doses and to be fully vaccinated. And then we have the Tyler Perry special, COVID-19 and the Black community. This really highlights some of the historical content that we lightly brushed upon earlier in the presentation and why there's hesitancies within the African American community and receiving the vaccine. We are going to have a Facebook watch party on March 5th at 1 p.m. So if you are a part of our patient Facebook group, You can watch it with us, and if you're not a part of our patient Facebook group, please join us. It's facebook.com/groups/IPRO ESRD hack. And then also, we just want to recognize that we're celebrating Black History Month. Understanding kidney disease in the Black community. Americans of African descent have the highest risk of acquiring kidney failure when compared to any other race. About 1 in 3 kidney failure patients living in the United States are Black or of African descent. Black Americans make up about 13% of the population, but they account for 35% of the people with kidney failure in the United States. Diabetes and high blood pressure are the leading causes of kidney failure among African Americans. So here we do have an infographic that highlights kidney disease as a silent killer targeting African Americans. This was created by the American Kidney Fund. And these are just some credible websites for research, information, and resources on the COVID-19 vaccine. We do have the Center for Disease Control and Prevention listed, the World Health Organization, and a Medical Library Association, as well as WebMD, the Dialysis Patient Center, and the National Kidney Foundation. And then we have closing remarks with Laura.
Thank you, Danielle. I want to thank everybody on the line for joining us. We have one more favor to ask you. If you could, please complete our post-event evaluation. We really need your feedback, and we value what you and your experiences have to say about the topics that we've discussed tonight. Look out for our PAC newsletter, PAC Matters, Connecting the Community, in your inbox soon. We have, as mentioned, a virtual support group for patients. The next meeting is next Thursday, February 25th at 5 p.m., and dial-in information is provided. Please follow us on social media. We have a great website, esrd.ipro.org, which has great resources and contact information for all of us. And we want to remind you, because of the winter weather and what we've been experiencing across the U.S., you can visit casercoalition.com to look for resources for ESRD patients in preparing for emergencies. And we want to make sure that you are having that conversation with your healthcare team about the COVID vaccine and its availability in your state. This is just our Facebook page and what it looks like, so you know. This is our website, and we are going to let you go for the evening. Thank you all so much for joining us this evening. We're already about 60 minutes over time. Again, if you have any questions, please contact us. We want to also thank our guest speakers, Dr. Krishnan and Renita Peck. And here's our contact information on the screen. As we close out this presentation, we'll leave this up for a moment so you can write it down if you need to. But thank you all for joining us, and we appreciate you. Have a great evening, and we'll talk to you soon.